And I said, we're going to do this at the Garden City Hotel, and we want people to come, we want them to feel good about themselves. And I did my little spiel, and this lady comes up to me and says, you know, what are you doing at the Garden City Hotel? There's enough of this, you know, let's keep quiet about it. And I said to her, I don't want to be quiet about it. I don't want the silence about it. We're not putting it in the closet anymore. It's coming out. So today we're breaking the silence, but I'd like to give you a little bit of a vignette. I do have a couple of other interests in this world. We don't have to go to medicine. I just see medicine in different things. But I like to see it in art. And I'm going to tell you something that I think there's been a hidden bit of shenanigans going on. Because artists have been holding the silence until recently. The picture you see over there is from Ravenna. This beautiful place is the most. She was queen of the Byzantine Empire. She was Justinian's wife. You gotta know about Theodora. Theodora was the second wife of Justinian. He met her as a sexual acrobat in one of the great gymnasiums in the Middle East. And at that time, there are passages that are written that said that this woman never had a drop of clothes on. She loved her body, and she wanted everybody to see it. And they did. And Justinian, when his wife died, a day later, he marries Theodora, and she becomes the queen again. And about 10 years later, she develops breast cancer. Physician named Actos. And the passages we have to this day, and he described to her mastectomy in the same terms that Dwight would use now. And it's amazing. But in those days, of course, this was. And Theodora said, no, I'm not going to do this. I'm going to die with my cancer. And everything left after that we have of Theodora are pictures like this. You never see anything below her neck. She hid it. All the jewels, all the splendid robes, because she would literally die without having a mastectomy with this horrible tumor. And so we have this little vignette that's buried in history. And then we go a little further. Are there other little messages like this? Well, and in Florence, there is the tomb of Lorenzo de' Medici by Michelangelo. And there's two parts to this. One's called the day, which you're seeing right now, and there's the second part called the night. And on the left side, you see a female statue. And for centuries, they said, Michelangelo must have had a bad day. Because you see the breast, the left breast, it doesn't look right. It looks a little bit that there's something misshapen there. There's a bulge there. There's a tumor there. What he showed would then realize centuries later, the polar orange, the change of the skin, the lumps that are there. But he did this in a secret. He put it on the knife, that this was something to be hidden. We go back more in time, we go a little bit further. We had a very famous mistress. Her name is Heinsberg. And there are a series of great paintings known as the Shiva paintings. And one of the most famous is Bathsheba's bath. And once again, if you take a look at Bathsheba, her left breast, those you can see, Heinrich would die of a chronic disease of breast cancer, and he killed it. Rubens later on, in his Three Graces, the tallest one on the right, her left breast too has an ulcerated lesion and it has the arm. He put it there. What type of message? We can't talk about it. The silence is here. We know it exists, but we can't talk about this. Later on, in the middle 19th century, we start to get to that realism type of portraits. A year or two ago to see this incredible work by Eakins. And here we have the Gross Clinic, one of the most famous paintings in medicine. And it shows that in this amphitheater, the students are learning about a mastectomy. Very cold, very scientific, nothing else. It became a revelation. And that revelation is that silence has to be broken. And we have something different that artists show us in the latter part of the 20th century. That the artists would see that their struggle would be the exclamation point of how things will be better. That they will achieve more from their disease than just staying in the background and covering it up. That it will be a point of their therapy and their conquering of their disease. Stacy mentioned that breast cancer is no longer just an American phenomenon. It is around the world. The front cover of Time magazine saying, hey, it is here. It's not in the closet. We're not going to go there. So right now, I look at that evolution of silence to exclamation point. And I think when I take a look at a patient that has an early breast cancer, that means that N stands for nodes. It has nodes that are involved by this tumor. And they may have what we call an estrogen receptor. That means a little bit of a ignition key. I'm in a perplexing situation, as most oncologists are. Traditional ways of looking at this, the size of the tumor, the age, whether or not there's some type of ideas of how fast it's growing, all sound very nice. But the real impact of what's going on in that individual patient. If I look at what can I offer? Can I offer chemotherapy? Many women are offered chemotherapy, but only few will benefit. Undertreated. Oh, they're old, they're not going to metastasize, we can't do anything bad. Leave her alone. Oh, she's young, let's throw a book at her. We got to go for it. Dwight and I have this conversation fairly often. And we wring our hands. Instead of wringing our hands, we're going to do a simple test. We can go back to the original tumor and look at 21 genes. 21 genes that can tell us the blueprint of this terrorist. To tell us whether or not that tumor is really going to metastasize. That's the name of the game. We want to know what's going to cause trouble. We want to know what is the risk, not just in this room, but in an individual patient. And lo and behold, we can get a scorecard. We can look at these chances that this will metastasize, and then I have the blueprint of the terrorist. I can go forward. This type of technique of going back to the tumor and individualizing and targeting the therapy 50% of the time. That's remarkable. Because it tells me that I'm over-treating 25% of my patients and under-treating 25% of my patients. And now I have better than the patient's age, better than the size of the tumor. I now know the intention of that tumor once and for all.